Hello everyone, welcome back again. Hope everything is fine. Today we are going to discuss about another common orthopedic condition, that is patellofemoral syndrome or chondromalacia patella or patella tracking disorder. This condition is very common in young athletes and in older people with arthritis. Here mainly we will discuss about what is chondromalacia patella and what mechanism actually causes this condition and what are the physio exercises like stretching or strengthening to get relief from this condition. Chondromalacia patella is otherwise known as runner's knee. Basically what happens here is the cartilage on the undersurface of patella gets softened and damaged by the overuse or due to the muscle imbalance. To understand this mechanism, you need to understand the basic anatomical movement of patellofemoral joint. Normally, your kneecap resides over the front of your knee joint. When you bend your knee, the backside of your kneecap glides over the cartilage of your femur or thigh bone at the knee. We have tendons and ligaments to attach kneecap to our shin bone and thigh muscles. When any of these components fails to move properly, it can cause your kneecap to rub up against your thigh bone. That means rub up against your femur. And this abnormal rubbing can lead to deterioration in the patella, causing chondromalacia patella or runner's knee. Improper knee alignment may result from poor alignment due to congenital conditions, weak hamstrings and quadriceps muscles, that is the muscles in back and front of your thigh, muscle imbalance between adductors and abductors like the muscles inside and outside of your thigh, repeated stress to your knee joints such as from running, stair climbing or jumping, etc., a direct blow or trauma to your kneecap. Who all are at the high risk of this chondromalacia patella? Adolescents and young are at the high risk. Females are more likely than males to develop runner's knee. Flat feet place more stress on the knee joint. Any previous injuries to kneecap such as dislocation. High activities levels or engaging in frequent exercise that place pressure on knee joint, and arthritis. When we talk about muscle imbalance, the main muscle imbalance happens in between VMO, that is vastus medialis obliquus on one side, and vastus lateralis and IT band on other side. Because of any of conditions like because of overuse or any other stress, when your VMO gets weak and your vastus lateralis and IT bands get tight, what happens there? This tight vastus lateralis and IT band starts to pull this patella to lateral aspect. Normally, our patella slides over the groove, and when this pulling happens, patella will pull to lateral aspect and it will start to slide over the lateral condyle of the femur, and this sliding will leads to the rubbing of undersurface of patella, and it will lead to this condition, and this rubbing will cause us the grinding like sensation in our knee. So it was the mechanism behind this condition. And if the cause of this chondromalacia patella is overuse, then sometimes a simple rest will make a big change. That means if you take rest for some time, you can get relief from your pain. But if the cause of this condition is muscle imbalance, then you need to stretch your tight muscles and strengthen your weak muscles.
Next, we'll move to physio aspect of chondromalacia patella. Physiotherapy should be emphasized on pain relief and improve functional activities associated with this condition. Here, controlling pain, stretching, strengthening, and prevention are the main methods that we have to focus more. For controlling pain, give ice for 10 minutes at a time, 5 to 6 sessions a day, and avoid activities that include excessive stress to your knee joint. Next one, stretching. Try to relieve your pain by making sure you are doing proper stretching. Next one, strengthening. Strengthening the muscles of your knee and hip to make your joints stable and to return to normal activities. Next one, prevention. Prevention of excessive strenuous activities, prevention of improper footwear are some important factors. You may also want to think about changing your footwear if it looks like the soles are worn out. If you are a runner, you should consider changing your shoes every 300 to 500 miles. First, we'll see strengthening exercises. Some important strengthening exercises are: first one, quad sets for knee extensors. Keep a small towel under your knee and then press your knees down. Hold for 5 seconds, then make it relax. Repeat this exercise 10 sets for 15 repetitions. Next one, straight leg raise, 4 hip flexors. Tighten your above knee muscles, lift leg up, hold for 5 seconds, then slowly lower your leg keeping your muscles tight. Do 10 sets of 15 repetitions. Outer hip raise, 4 hip abductors. Keep your toes pointed slightly downwards and keep your knees straight and then raise your leg sideways up. Holding and repetitions are same. Next one, inner hip raises, 4 hip adductors. Lie on your affected side and support body with unaffected leg. And then keep affected knee straight and raise leg upwards. Holding and repetitions are same. Next one, backward hip raises, 4 hip extensors. Lie on your belly and raise your leg straight backwards by keeping your knees straight. Holding and repetitions are same. Next one is strengthening of very important muscle, that is VMO, vastus medialis obliquus muscle, which is the last 15 to 20 degrees of extensor of your knee joint, and is very important to make your knee straight and stable. We can do VMO strengthening in different ways. First one, in line. You can bend your knees up to 60 to 70 degrees and then press your knees together by placing a towel in between. Hold for 5 seconds and then make it relax. Repetitions are same. Next one, in sitting. In sitting, the same way as you did in lying position, that is, place a towel in between your knees and press it together. Hold for 5 seconds. Repetition is same. One other advanced method is by pressing your knees together, you can extend your knees by making your VMO tight and hold for 5 seconds, then relax. Repetition is same. One of the important VMO strengthening exercise is short arc. Because VMO is the last 15 to 20 degrees of knee extensor, this exercise is one of the best for VMO strengthening. Here, bend your knees up to 15 to 20 degrees by placing a pillow or thick towel below the knee. And make the knee straight and hold for some times, then relax. Repeat the same. Next, we'll move to stretching. Important stretching we have to do for vastus lateralis and IT band, hamstring, quadriceps and hip flexors. First, we'll see vastus lateralis and IT band stretch. To stretch vastus lateralis and IT band, in lying position, you need to bend your opposite leg and then place affected leg on opposite thigh by bending it, and need to stretch in this way. That here you can get stretch to your left vastus lateralis and IT band. By bending your opposite leg, you can get support to your lower back. Repetition for 5 times and 3 sessions a day. Next method, in sitting. You can place your affected leg on opposite thigh and then bend your body with your upper limbs hanging down, holding for 10 seconds and then make it relax. Repetition is same as earlier. Next one, for IT band. You need to stand with leg to stretch on the side of the wall and then cross your leg to its back of opposite leg and then lean your body towards the wall with bending your trunk to opposite side. And this method gives a nice stretch to your IT band. Holding and repetitions are same. Next, quad stretch. Stand with support on a table or wall and bend your knee that you need to stretch to backwards and support with your hand and apply a stretch force by bending it forcefully. Holding and repetitions are same. Next one, hamstring stretch. You have to place your leg to stretch on a table or a chair with proper positioning of your body and then lower your body by bending opposite knee. You will get a nice stretch to the back of your thigh. Repetitions are same. So, by doing proper stretching and strengthening, you can get relief from this chondromalacia patella. But before doing any of these exercises or stretching, you need to consult with your orthopedician and you need to take guidance with your physiotherapist.
So, these were all about chondromalacia patella or patellofemoral syndrome or patella tracking disorder. See you soon in next video. Till then, bye-bye.